We had more than 16 million doses of COVID vaccine that had been given in the state of Washington, and just about 75% of Washington's population completed a primary series, and that's for ages over 5 and above. In addition, over 60% of eligible people received at least a booster of some sort, again, over the age of 5. So as we continue to see this movement towards the end of the public health emergency, we know that high levels of vaccination, widespread population immunity, and available treatments have certainly done their part to significantly reduce the COVID-19 risk in our communities, both from transmission of COVID-19, but also equally and perhaps more importantly from severe illness such as hospitalization and death. And we should all be proud of what this state has accomplished. It's a great time for us to reflect on all these efforts to get to where we are now. But let's be clear that our fight against COVID-19 continues to be a priority for us. We still need to continue to do all possible to continue to protect the health and well-being of our loved ones and our communities. And this is not just about COVID-19, but the impact of COVID-19 as well as the impact on healthcare access, as well as even other kinds of protections such as vaccines for children, vaccines for adults that are not just COVID-19, but well beyond those as well. Throughout this pandemic, we have certainly continued to move forward together. We need to recognize the incredible leadership of our elected officials, and I want to start with Governor Inslee and his administration and the amazing work that he and individually, but also with his team did to help support as well as lead the efforts in our great state of Washington. And our other elected officials that continue to help support us throughout this pandemic that could not have done any of this work without our policymakers at our side. In addition, our state partners, as you know, again, HCA is with us, but HCA represents only one of those amazing partners at the state level who continue to work with us. And I can count so many different partners who just did so much on a 24/7 basis to help support the public health mission of protection as well as health. Our local health jurisdictions, our tribes, our private partners, community-based organizations, everyone who was part of that ecosystem of protecting health in local communities. And of course, Washingtonians who continue to do everything in their neighborhoods, in their families, in their communities to support the efforts that we all engaged on as a state. Throughout the pandemic, using the raw numbers that we have, Washington has consistently had one of the lowest death rates among states over the duration of the pandemic. Currently, we're fifth from that standpoint. And that's quite remarkable, again, when we think about the fact that we had the first case, the first outbreak, and the first death in the continental United States. And despite that, the incredible efforts of everyone coming together. A recent study published in Lancet found that Washington state had the 6th lowest adjusted rate of COVID-19 deaths in the U.S. during the pandemic when adjusting to account for both age and comorbidities. So a lot has been accomplished. And what we're going to do in the next several minutes is unpack what the end of the public health emergency means for our state, as well as what it means across the country. But let's not forget that as this public health emergency declaration is complete, of all the people who unfortunately are not with us today, and more than 16,000 Washingtonians, more than 1 million Americans, and more than 7 million people across the globe who have died from COVID-19. Let's not forget that every single number represents a person, an individual, a family member, a coworker, a community member, or someone we knew, a mom, a dad, son, a daughter, a brother, a sister. And that, unfortunately, is what this horrible virus has meant for all of us in our communities across our globe. So we have an opportunity now to not just reflect on what's occurred, but also to be thinking ahead in a transformative way to really improve the health and well-being of all of us. So I want to thank all of you. I want to thank as well our media partners who have always been there throughout this pandemic. And I want to reflect on the fact that we have so much to be proud of as a state, and yet we also recognize there's so much that lies ahead for us as well. So with that, I will turn it back and we can now dive into more specifics about what the end of the public health emergency will mean for us here in the state of Washington.
Thank you so much, Secretary Shaw. Next, we'll hear from Chief Science Officer Dr. Tao Sheng Quan Get.
Thanks, Kara, and good morning, everybody. The end of the public health emergency means that as a society, we are transitioning our COVID-19 response from an emergency response phase to a new phase. And it's important for us to remember that the pandemic is not over and that COVID-19 will be here for the foreseeable future. Since the beginning of the pandemic, nearly 2 million COVID cases have been reported in Washington state. And these reported cases are an undercount of actual cases, as many positive home tests do not get reported. You're heartened to see that despite new subvariants circulating in the community, hospitalizations have been trending down since the beginning of the year. However, dozens of deaths still occur each week, and the most vulnerable are the elderly and those with chronic conditions. So COVID-19 remains a serious concern, particularly for members of our community at the highest risk of hospitalization and death. It's also important to remember that COVID-19 has serious impacts in addition to hospitalization and death. Anyone who gets COVID-19 can develop long COVID, which is when people continue to have symptoms weeks, months, or even years after infection. Long COVID is a real disease that is estimated to affect more than 300,000 people in Washington state, many of whom have suffered enormous impacts to their quality of life. Here at the Washington Department of Health, we've been talking with many of our state's subject matter experts about increasing public awareness of long COVID, as well as increasing access to diagnosis and treatment, especially for rural communities. Long COVID can be especially difficult to diagnose in people who weren't tested during their initial infection. And this makes it important to continue testing for COVID-19 when you have symptoms. Many people at higher risk for severe COVID-19 are also at risk for long COVID, and prompt treatment with antiviral medication can reduce your risk of both severe illness as well as long COVID. Speaking of testing, I want to remind people that until May 11th, most Washingtonians can still order free at-home COVID-19 tests to be delivered to their door. And you can check your eligibility by entering your zip code at the Department of Health's Say Yes COVID Test website. We're proud to report that as of May 3rd, nearly 3.1 million individual orders have been fulfilled, totaling over 15 million test kits delivered to nearly 1 million households throughout the state. Though currently supply is focused on those communities with the most need, still 86% of state residents are eligible to order tests through Thursday. After that, you may still be able to order tests through the federal program, which delivers 4 free at-home tests, or you can check with your insurance provider. Tests are also widely available to buy at pharmacies without a prescription. And the Washington Department of Health will continue to support schools with access to testing supplies into the 2023-2024 school year. So this can be another point of access within your community if your school offers COVID-19 testing services. The Department of Health will continue to support access to testing through local health jurisdictions and tribal partners, early childhood education centers, fire and emergency medical service partners, homeless shelters, and rural independent pharmacy partners. So in conclusion, though the public health emergency is over, the pandemic is not over. We have vital tools such as testing, vaccines, and medications to help keep our communities safe and healthy. And our challenge now is to use these tools and work together to protect the elderly and the most vulnerable in our communities. Back to you, Kara.
Thank you, Dr. Quanget. Next, we'll hear from Chief of Prevention, Safety, and Health, Lacey Fehrenbach.
Thank you, Kara. Good morning, everyone. As Dr. Shaw mentioned, the end of the National Public Health Emergency impacts funding for some tools and programs we've used for a long period of time now in our fight against COVID-19. WA Notify is one of these tools. The exposure notification system will be discontinued on May 11th of 2023. Once the system is decommissioned, your phone will no longer notify you if you were near someone who tested positive for COVID-19. Those of you who use WA Notify may receive a push notice to your phone about this around that date. I do want to note that since the statewide launch of WA Notify, which happened way back on November 30th of 2020, 235,000 COVID-19 cases were confirmed in WA Notify, and that generated more than 2.5 million exposure notifications. And those notices allow people to more quickly take action to isolate themselves away from others, test themselves, seek treatment if they need it, and help us avoid further spread of the disease. WA Notify prevented thousands of COVID-19 cases in Washington state and helped us save more lives over the duration of the pandemic. Our state was one of the first states to implement exposure notifications and has had one of the highest adoption rates. We currently have, I believe, just under 4 million activations. I think the very precise number, to use Dr. Shah's earlier reference, is 3.95 million. And much of the program's success is due to Washington's uptake of WA Notify, as well as the unique collaboration we had among public, private, and academic partners. And these included Apple, Google, Microsoft, and the University of Washington. The tool is supported at the national level through a partnership with the CDC, the Association of Public Health Laboratories, and Apple and Google, and resources related to this national support end with the public health emergency. WA Notify will be available for a few more days up to Thursday, May 11th, and we encourage people who test positive in that time to continue to anonymously notify others through the use of WA Notify. After May 11th, if you test positive, please take care in your community and notify the people you've been in close contact with that they've been exposed. DOH continues to look for ways to leverage this effective and innovative technology in the future as we respond to other types of emergencies. And while WA Notify and other programs may be going away, we continue to stay vigilant in working to protect ourselves and our communities against COVID-19. This means staying up to date on your COVID vaccine, wearing masks in poorly ventilated or crowded indoor spaces, staying home if you aren't feeling well, and seeking a COVID test or treatment when needed. And with that, I will pass it back to you, Kara.
Thanks so much, Lacey. Next, we'll hear from Assistant Secretary of Prevention and Community Health, Michelle Roberts.
Well, good morning. I'm going to talk a little more about vaccine recommendations. So as my colleagues have said, while the public health emergency may be ending, we still have tools at our disposal to lessen the impact of COVID-19 and keep ourselves and our communities safe. And the single most important tool we have access to is the COVID-19 vaccine. The CDC has taken steps to simplify COVID-19 vaccine recommendations and allow more flexibility for people at higher risk who want the option of added protection from additional doses of COVID-19 vaccine. Everyone age 6 and older should get one updated bivalent mRNA COVID-19 vaccine, regardless of whether they have previously completed their primary series. CDC's new recommendations also allow a second dose of the updated bivalent vaccine for adults age 65 and older. People who are moderately or severely immunocompromised may also get additional doses of the updated vaccine. This allows more flexibility for healthcare providers to administer additional doses to immunocompromised patients as needed to provide them the best protection. The original monovalent mRNA COVID-19 vaccines will no longer be recommended for use in the United States. So the bottom line is that individuals age 6 and older who have already received an updated mRNA vaccine do not need to take any additional action unless you're 65 years or older or immunocompromised. For young children, multiple doses continue to be recommended and will vary by age, vaccine, and which vaccines were previously received. So if parents have questions, we recommend they talk to their healthcare provider. Alternatives to the mRNA COVID-19 vaccines remain available for people who cannot or prefer not to receive an mRNA vaccine. CDC's recommendations for the use of monovalent Novavax or Johnson & Johnson's COVID-19 vaccine were not affected by these changes. The federal government is still providing free, no-cost COVID-19 vaccines as long as the supply lasts. This fall, we expect COVID-19 vaccines to start to be treated like most other vaccines, which healthcare providers purchase from manufacturers and distributors to give to their patients. This summer, we expect to learn more from our federal partners about future COVID-19 vaccine boosters, including potential updates to the COVID strains in the vaccines. As always, the Department of Health recommends speaking with your personal medical provider with any questions or concerns you have around COVID-19 vaccines. You can also visit the DOH COVID-19 website to learn more about current vaccine recommendations, or the website listed on the slide, or text GetVax or 438-829 to search for vaccines by zip code. I also want to talk about another vaccine today, the Mpox or MPV vaccine. We want to remind people that while disease levels are low, Mpox is not over, and we're still seeing a few cases. As Pride Month and festival season approaches, we want to stress the importance for those in higher risk groups, specifically the LGBTQ+ community, to protect themselves and their communities against the spread of Mpox by vaccinating themselves as soon as possible. It's also important for people who've only gotten their first dose to be sure to get their second dose. This helps ensure they have the most durable protection available. Well, MPV is disparately affecting gay, bisexual, and other men who have sex with men and their sexual networks, and especially affecting people in the community who identify as Black. Anyone can contract this virus, regardless of sexual orientation or gender identity. We encourage people to seek medical attention if they're having symptoms, especially an unusual rash, and also to make sure they're being tested for HIV and syphilis if they think they're at risk for Mpox. Washington has seen 697 cases of Mpox since it was first detected. And while no new cases were reported in the last monitoring period, we have had a few cases reported earlier this year, mostly associated with travel. This is why vaccination continues to be important for those at risk. I'm happy to say that as of April 30th, there have been over 32,000 doses of MPV vaccine administered here in Washington state. Mpox vaccines are still no cost to the public. Providers must give you the vaccine regardless of your ability to pay the administration fee. Since January 2023, Caravan has held 40 clinics across the state offering Mpox vaccine at no cost, and we're scheduling several future Caravan events where Mpox vaccine will be available. To find Mpox vaccines near you, visit the Caravan website to find an upcoming clinic in your area. Or you can also find this information by just visiting doh.wa.gov. Vaccines continue to be our best defense in protecting ourselves and our communities against COVID-19 and Mpox. We encourage everyone to stay up to date with their vaccines and talk with your healthcare provider if you have any questions. Thank you.
Thank you, Assistant Secretary Roberts. And finally, we'll hear from Jason T. McGill, who is the Assistant Director of the Medicaid Program Division at the Washington State Healthcare Authority.
Great. Thank you, Kara. Thank you, everyone. It has been such a difficult 3 years in partnership with our public health agencies, our hospitals and providers, and I really appreciate the work with our partners here at Department of Health and Secretary Shaw and your team. Thank you. You may be familiar with Medicaid. Medicaid is a federal and state partnership program that covers people with low income, many children, adults since Medicaid expansion in 2014. We call it here in Washington Apple Health. You may be familiar with Apple Health as the term we use for Medicaid. Today, 2.2 million people are on Apple Health. That's nearly 1 in every 3 to 4 Washingtonians. And what this means in terms of the end of the pandemic is that our current estimates show upwards of 300,000 to 500,000 people may lose their Apple Health coverage because the pandemic protections that were in place in terms of eligibility and coverage will end. However, the good news is we've been preparing for this since the beginning of the pandemic and these changes. Most people will have coverage such as employer coverage, or they will have aged out of Medicaid and into Medicare and have Medicare coverage at 65, age 65. So most people will be covered. However, we have to do all we can for those who may lose coverage and become uninsured. So two things I will just point out that we've been working on: making our systems as smooth and easy as possible for people to use to ensure that they can go to Washington Health Plan Finder and input their information and make sure and see if they are eligible. And they will continue their Medicaid coverage. Vast majority will continue coverage. Or if they have lost coverage and need coverage, the Health Plan Finder can offer them almost $0 coverage through what we call our qualified health plan process. And Congress has fortunately produced significant subsidies for people who need that coverage. In addition, we have many people throughout the communities in our health care clinics, our insurance programs, who are ready to help and assist people who need to navigate through this. So we are hopeful we can mitigate that loss of coverage as much as possible, but we must be prepared to do what we can for the people who may become uninsured. Right now in Washington, we have historic uninsured rate of about 4%, but that will go up, and we need to be prepared, and again, doing all we can. Perhaps just a quick note on vaccines. Medicaid will continue covering all vaccines, including COVID vaccine, and that will be free of charge at any participating network, pharmacy, or clinic. And we'll continue doing that after the end of the pandemic as well. We'll also be covering tests, COVID tests, certainly at clinics and healthcare facilities as needed, but also over the counter at pharmacies, at least through September 2024. So I can go on and happy to take questions and other details, but I'll end there.
Alrighty, Jason, thank you so much. This brings us to the Q&A segment of today's briefing. We have several media partners with questions today. Our first question comes from Joy Borkholder with the Daily Herald. Go ahead, Joy.
Thank you. I just have one quick question for Jason. When do the first letters go out notifying current Apple Health enrollees that they need to take action?
Thank you for the question. The first letters actually went out April 1st, giving a 60-day time frame before end of termination, which would be the first group. Perhaps terminating coverage will occur at the end of this month, end of May.
Can you share anything about how many folks have actually responded and taken action?
We're working on collecting that data now. Some very early numbers show upwards of 10% may be losing coverage from Apple Health, but many seem to be already covered through, say, employer coverage. So they may have lost a job during the pandemic, gained a job, and now do not have the income to qualify for Apple Health.
Alrighty, our next question comes from Allison Morrow with Morrow Media. Allison, go ahead.
Thank you. I have a couple related questions. The first is, what is the recommendation going to be for businesses and government agencies who still have vaccine mandates at this point? Also, mask mandate for healthcare centers. And can you explain it? Looking at the graph of the hospitalizations and deaths, it appears that the highest rate was in the January, February 2022 timeframe, which came a few months after a lot of the mandates were enacted, and then several months after the vaccine rollout. Can you explain that as well, please?
Thanks, Allison, for that question. The last question related to the graph, I'll let Dr. Quanget process that, and Lacey and I can tag team on your first question. I think one of the things that we've made very clear is that we continue to support what's happening throughout our state when it comes to supporting or protecting health and well-being. And so when that means agencies or entities may require something, we will continue to support that. That is something that we have championed throughout the pandemic, and certainly even recently when the statewide requirements, for the most part, at least from a Secretary of Health standpoint, for masking requirements in healthcare facilities and other places that ended on April 3rd, we had that additional message, which was we would continue to support what was happening at a regional or a local or a facility standpoint from with respect to, in this case, masks. So we continue to have that same stance. We want to support what's happening at that local level, but also recognizing that we're at a different place as a state. And so depending on what those policies are from a state perspective, we're continuing to be aware of what's happening both at a federal level and then certainly what's happening at a regional or a local level. Lacey, anything you want to add to that?
I think what I'll add, in addition to local governments, businesses, healthcare facilities making choices based on their physical plant space, their risk, and the conditions at the local level, is that in Washington state, COVID remains a workplace hazard, and employers have a responsibility to protect their employees related to that. And so employers may choose to still require vaccinations or masks as part of their mitigation of COVID-19 in the workplace.
Lacey, thank you so much. Our next question comes from Olivia Palmer with the Cascadia Daily News.
Sorry to interrupt. We had a second question there that Dr. Quanget was going to answer.
Yes, I'd be happy to answer the question about the peak in hospitalization rates that was observed in January 2022. That corresponded to the advent of the Omicron subvariant, which was much more transmissible than prior variants, and also had a degree of increased ability to evade immunity from immunization and previous infection. So masks were an important tool of preventing spread in healthcare facilities. During that time, the spread of the SARS-CoV-2 virus was just so prevalent in the communities that resulted in the increase in hospitalization rates, despite the use of infection prevention measures in our healthcare facilities, including the use of masks. Thanks.
Alrighty, thanks so much. We'll head back to Olivia with the Cascadia Daily News. Olivia, go ahead.
Hi, thank you. I have a question about you mentioned in early April, the mask mandate in healthcare settings was dropped. I'm wondering if we have any initial data that indicates the impact of that on the spread of COVID in those facilities, especially for vulnerable populations and long-term care facilities.
I don't know if Dr. Quanget or Lacey may have any additional information. Obviously, as you know, we continue to monitor things. We've made it very clear as we launched last year the WA Forward and follow the WA Forward plan that we're going to continue to do whatever monitoring we needed to do in not just facilities, but communities across our great state. And we've continued to have that same mantra this year, including with any changes in policy direction from a state level or even at a local or a regional level. So I don't know or believe we have any data per se, but let me turn it over in case one of my colleagues does have something that they want to share.
That's correct. We don't have any specific data evaluating the impact of the change in mask requirements. However, we are heartened, as I mentioned earlier, that hospitalization rates have continued to decline since the beginning of this year, as well as through the time, as well as after April 3rd. So we have aligned our infection prevention recommendations with the Centers for Disease Control and Prevention, and we have confidence that that they will continue to be effective at reducing hospital-associated infections. Thanks.
And we'll take one last question from Kate Walters from KUOW. Kate, go ahead.
Yeah, thank you all so much for taking the time to do this morning. I have a couple of questions, if you'll indulge me. Jason, wanted to ask a question about the Medicaid rolls. Can you talk a little bit about any impact on the Marshallese community here, considering that it was during the pandemic that they were able to gain access to that program, and there tends to be potentially issues of language barriers when it comes to getting information into that community? And then for Dr. Shaw or anyone else who would like to answer it, can you tell me what do you think the biggest or most noticeable change for people in the state will be when this public health emergency ends? Thank you.
Thank you, Kate. Do you want me to take that first, Secretary?
Yeah, Jason, go ahead.
Thank you, Kate. Yeah, so you were mentioning the Marshallese community particularly, who are now qualified for Medicaid outright. And yes, these populations that have language access issues, and we have full interpreter services and language access services available, but you're absolutely right. There are added challenges in terms of navigating the systems. Fortunately, in Washington, we've really invested in making it much easier for people through our health plan finder and online services. We have also invested in our navigators. And again, I mentioned earlier, many healthcare clinics and our health insurers all participate to help people through these changes. So we believe we've done all we can to prepare for this, and very optimistic about, but again, you're right, Kate, in terms of noting a population in special need. And there may be people who will lose coverage. I will note, as a safety net for people who do lose coverage, is a 90-day period after that loss of coverage where they can system is very well attuned to getting them re-enrolled at that later date. And it's 24/7, 365 that you can apply for coverage, again, through the health plan finder in Washington State.
Thank you, Jason. Kate, would you mind repeating your first question?
Yeah, of course. I was just asking what you think the most noticeable or the biggest change for Washingtonians will be when the end of this emergency comes about.
Well, thank you. I think, and I am going to ask if Nate Weed or Michelle Roberts have anything they want to add as well. What I would say are one of the things that, as we've been talking through with our federal partners, and as you've heard all of us speak to, but also in particular with what Jason mentioned from the Medicaid perspective, is that it's not as if you're going to wake up on May 12th and the ability to access the vaccines or therapeutics or tests, et cetera, will all of a sudden not be there. What the federal government has assured us is that it will, over time, those resources will be used up, and they were obviously, unless there are additional investments, will not be there. However, on the next day, or for a short period or some period of time coming, those resources will continue to be in play in the state of Washington. And certainly whatever resources that we at Department of Health and our partners at the state continue to have, we will certainly put those resources out in our communities. And there are also additional mechanisms, as you've also heard from a federal CMS standpoint, also from a Medicaid standpoint, that people on certain funding streams will continue to have access, additional additionally. And then certainly we want to make sure people are checking with their private insurers for the opportunity to be able to check and see what supports are available there. So I think the big thing that Washingtonians should think about on May 11th or when they wake up on May 12th is the fact that we have gone through a long road, and the public health emergency phase, the actual declaration piece has ended, which I think in many ways, as we look back over the last 1,190 days, reminds us of how difficult of a road this has been, but also gives us hope and positivity towards the future that we hopefully have turned the corner on so many challenges that we've had related to COVID-19 in our communities. So I don't think that the next day people will note something that will significantly change. But over time, absolutely those investments and the policies and those activities that were related to both of those will change over time. And that's what Washingtonians will start to sense and start to observe as they continue to move forward in their lives. So Nate or Michelle, anything you all want to add?
Yeah, thanks for that. And I think you covered it really well. You know, the nature of most emergency proclamations or declarations is that they really free up a lot of administrative activities that allows government agencies to either procure or gather or provide flexibility in how we do business. So for many in the public, I think we as a state, our proclamation ended on the end of October this last year. I think most people didn't really even see that change as things went on. And that's largely because many of the things
addition to a lot of ability to access tests and vaccines and treatments will transition back to your regular healthcare benefits. And so I know my insurance company sent me a letter already. And so watch for those in the mail about what my benefits will look like ongoing. And the bottom line really is that they transition back to how your benefits work for your regular healthcare plans. So just be looking for information and checking with your health insurer going forward. And then again, just a reminder that as Lacey mentioned, WA Notify ends on May 11th as well.
Thank you so much. This concludes the question and answer segment of our briefing. And now we'll head back to Secretary Shaw for closing remarks.
Well, first off, let me thank all of you, our media partners, for joining us. You've been every single time we have called upon you, you've been there, and we really appreciate all of the partnership throughout this pandemic. I also want to thank all of the folks who have joined me here today, as well as the countless number of other individuals on our teams and our partners across the state. There's just not enough time to thank people for the amazing amount of dedication that they put in, giving up so many things to be able to continue to serve Washingtonians. I want to thank Lacey. I want to thank Michelle. I want to thank Nate. I want to thank Tao, and I want to thank Jason for joining today for us to be able to provide this information to the public. I think it's also important that we remember that we're continue to be in this together. As we've heard so many times before, we might be tired of COVID-19, but this virus has shown that it's not tired of us, and we have to continue to be thinking about that, and yet not being overly thinking in a way that doesn't allow us to continue on with our lives. There's so many other things that we also need to focus on for our health and well-being. Your best shot, as we've said, is to take your shot. but it's also the other protections, and to be smart and using common sense as we move forward with what the next phase means, especially as we see the end of the public health emergency declaration next week. Our fight continues, but I will tell you, we are stronger and ready to address what's ahead. And that means all of us as Washingtonians. It is so important for us to be thinking about that collective spirit. Over the last 36 hours, I've been with our tribes. I've had a conversation today with one of our local health jurisdictions, for example, Jefferson County, as well as connection with the Seattle storm. And one of the things that we really talked about is the importance of the movement in how do we look at what is ahead for us. So it is so critical for us not to think about the whole gamut of the incredible way that we look at health and well-being, and not just about COVID-19, but all the immunizations and all the protections for our kids, for our families, for our communities, and for ourselves. So I just want to say thank you to Washingtonians. I want to say thank you to all of our partners. And I guess maybe I'll take a line from a sports metaphor and say, let's get cracking on improving the health and well-being for all Washingtonians. So with that, thank you so much for joining, and I will turn it back as we close.
Thank you, Secretary Shaw. This concludes today's media availability. I'd like to thank our panelists for their time today, our media partners for their continued coverage of Washington State Public Health, and TVW for hosting today's live stream and archives of past briefings.